Picture this. You're 23 years old, fresh out of nursing school, and the world is ending around you. Not from bombs, not from bullets, from something you can't even see. It's October 1918, and I'm standing in a hospital corridor in Philadelphia, watching people die faster than we can count them. The morgue is full. The hallways are full. We're stacking bodies in the basement because there's nowhere else to put them. My name is Catherine O'Brien, and I was a nurse during the Spanish flu pandemic. What I witnessed would haunt me for the rest of my life, and here's the terrifying part. Most people today have no idea just how catastrophic it really was. So buckle up. Because what you're about to hear isn't some sanitized history lesson. This is the raw, unfiltered truth about what it was like to live through the deadliest pandemic in human history. And I promise you, it's nothing like what they taught you in school. Let me start with some numbers that should absolutely terrify you. 50 million people dead, maybe even 100 million. We honestly don't know, because record-keeping collapsed in so many places. 1/3 of the entire global population got infected. In some communities, so many people died so quickly that there was nobody left to bury the dead. To put this in perspective, World War I, the Great War that was raging at the same time, killed about 17 million people over 4 years. The Spanish flu killed 3 times that many in just 18 months. 3 times. And here's what really messes with your head. This wasn't like other diseases that killed the very young and the very old. The Spanish flu had a sick sense of humor. It targeted healthy young adults in the prime of their lives. People who were perfectly fine at breakfast were dead by dinner. I watched it happen. Over and over and over again. I graduated from nursing school in Boston in the spring of 1918. I was idealistic, enthusiastic, ready to make a difference. The war in Europe was still going, and there was all this talk about patriotic duty and service. Nursing seemed like the perfect way to contribute. I had no idea what was coming. None of us did. The first whispers started in the summer. There were reports of an unusual flu outbreak at a military base in Kansas. Then it spread to other bases. Then to Europe with the troops. But nobody was particularly worried. The flu was the flu, right? People got sick. They recovered. Life went on. Except this time, it didn't. I remember the exact moment I realized something was wrong. I was working at Massachusetts General Hospital, and we started getting these cases that just didn't make sense. Young soldiers, fit as could be, coming in with what looked like regular flu symptoms. Fever, body aches, the usual stuff. But then they'd turn blue. I'm not exaggerating. Their skin would literally turn blue from lack of oxygen. We called it heliotrope cyanosis. They'd struggle to breathe, cough up blood, and within hours, sometimes minutes, they'd be gone. The first time I saw it happen, I thought I was losing my mind. The real nightmare began in September. The first wave of the flu in the spring had been bad, but manageable. People got sick. Most recovered, and we thought maybe the worst was over. We were so wrong. The virus came back, and it had mutated into something infinitely more deadly. I'd been transferred to Philadelphia by then to help with the overflow at Pennsylvania Hospital. The city was hosting this massive Liberty Loan Parade, thousands of people crammed together to support the war effort. Every public health official in the city warned them to cancel it. Cancel it, or people will die. They held it anyway. 200,000 people packed into downtown Philadelphia on September 28, 1918. Shoulder to shoulder, breathing on each other, touching, singing, celebrating. Within 72 hours, every single hospital bed in Philadelphia was full. Within a week, 4,700 people were dead. I'll never forget walking into the hospital the Monday after that parade. It was like a vision of hell. People lying on gurneys in the hallways, on the floors, anywhere we could fit them. The sound of coughing, wet, rattling coughs that brought up blood and pieces of lung tissue, the smell of death and disinfectant and fear. And the crying. Oh God, the crying. Mothers holding babies who'd stopped breathing. Young wives whose husbands had left for work healthy that morning and were now drowning in their own bodily fluids. Children sitting beside parents who would never wake up. We were completely overwhelmed. You want to know what a typical shift was like? Let me walk you through it. I'd arrive at 6 in the morning, already exhausted because I'd only gotten maybe 3 hours of sleep. We were working 16, 18, sometimes 20-hour shifts because there simply weren't enough nurses. So many of my colleagues had gotten sick. Some had died. The fear was constant. Every time my throat felt a little scratchy or my head ached, I'd think, is this it? Is this how it starts for me? I'd tie on my mask, just a basic gauze mask that probably did almost nothing, and step into the ward. And immediately I'd have to assess who was going to make it through the day and who wasn't. This is the part that still haunts me. We had to perform triage, but not the way you might imagine. We weren't choosing who to save. We were choosing who to make comfortable while they died, because there was nothing we could do for them. If a patient was turning blue, if they were coughing up blood, if their fever was above 104 degrees, we knew. They'd be dead within hours. Sometimes we'd give them morphine to ease the pain, hold their hand if we had time, and then move on to the next bed. Because there was always a next bed. The ones who still had a chance? We'd try everything. Aspirin to bring down the fever. Oxygen if we had any available, which we usually didn't. Cool compresses. Hydration. Prayer. Mostly prayer. The speed is what got to me. The terrifying, incomprehensible speed. You have to understand, this wasn't like tuberculosis or cancer where people declined over weeks or months. This was hours. I'd admit a patient at 8 a.m. who was coherent, talking, asking about their family. By noon, they'd be delirious. By 4 p.m., their lungs would be full of fluid. By midnight, they'd be dead. I watched a young woman, couldn't have been more than 25, die in less than 6 hours. She came in complaining of feeling tired and feverish. We got her into bed, gave her some aspirin, told her to rest. An hour later, she was struggling to breathe. 2 hours after that, blood was trickling from her nose and ears. The cyanosis set in, that horrible blue tint spreading across her face and fingertips. She looked at me with these terrified eyes and whispered, "What's happening to me?" What was I supposed to say? I didn't know what was happening. None of us did. By the time her husband arrived, he'd rushed from work as soon as he got the message. She was gone. I had to tell a man who'd kissed his wife goodbye that morning that she was dead before dinner time. That happened every single day, multiple times a day. Here's something they definitely don't mention in history books. We ran out of places to put the bodies. The hospital morgue was designed to hold maybe 20 bodies. By the end of September, we had over 100. They were stacked in the basement, in empty wards, in maintenance closets. The smell was indescribable. The undertakers couldn't keep up. The coffin makers couldn't produce them fast enough. Some families waited days, sometimes more than a week, to bury their loved ones. In some neighborhoods, bodies just sat in houses because there was nobody to collect them. Philadelphia started using steam shovels to dig mass graves. Can you imagine? Steam shovels. Like they were digging for construction, except they were making trenches for hundreds of bodies. I remember seeing a newspaper headline, "Bodies pile up like cordwood." And it wasn't sensationalism. It was just the truth. The city hired anyone who could drive a wagon to collect corpses. They'd go street by street, and people would bring out their dead. Parents carrying children, children carrying parents. Sometimes entire families would be dead, and neighbors would have to do it. There was this one moment. I was walking to the hospital for my shift, and I saw a little girl, maybe 7 or 8 years old, sitting on her front steps. She was just sitting there, totally calm, not crying. I asked if she was all right. She said, "Mama and Papa are upstairs. They won't wake up." Both her parents were dead in their bed. She'd been sitting with them for 2 days. What do you do with that? How do you process that level of tragedy? The medical system didn't just bend under the pressure, it completely shattered. In Philadelphia alone, about 850 physicians got sick. More than 100 died. The nurses? We were dropping like flies, too. Every week I'd hear about another colleague who'd gotten infected. Some recovered. Many didn't. Medical schools rushed students into service before they'd finished their training. First-year med students were performing duties that normally would have required years of experience. What choice did we have? People were dying, and we needed anyone with even basic medical knowledge. Volunteer nurses came in. Society ladies who'd never worked a day in a hospital suddenly found themselves emptying bedpans and changing blood-soaked sheets. To their credit, most of them stuck it out. They showed up, day after day, even knowing they might die. Because that's the thing. Everyone knew. Every single person working in those hospitals knew they were putting their lives at risk. Every breath, every touch, every moment spent in those crowded wards was potentially fatal. But what were we supposed to do? Walk away and let people die alone? We had this dark saying that went around: nurses who died have preference in heaven. Gallows humor was the only thing that kept us sane. The authorities tried to respond, but they were always 10 steps behind the virus. They closed schools, theaters, churches. They banned public gatherings. In some cities, they made it illegal to shake hands or not wear a mask in public. In San Francisco, they created an anti-mask league because people refused to comply. Imagine that, in the middle of a plague that's killing thousands of people a day, and folks are protesting mask mandates. Sound familiar? But here's the brutal truth. Most of the public health measures came too late. Philadelphia held that parade when they absolutely should not have. Boston kept the bars open. New York waited weeks before implementing restrictions, and people died. Tens of thousands of people who might have been saved if authorities had acted faster, stronger, more decisively. The public health officials who got it right, the ones who implemented restrictions early and kept them in place, their cities did better. Much better. St. Louis closed everything down at the first sign of trouble and had half the death rate of Philadelphia. Half. That's thousands of lives saved because some officials had the courage to act, even when it was unpopular. Let me tell you about some of the people I watched die. There was Michael, a dock worker. 29 years old, built like an ox. He'd survived 3 years fighting in France, came home without a scratch, and was dead from the flu within a week of returning. His wife gave birth to their first child 2 days after he died. He never got to meet his son. There was Sarah, a schoolteacher. She came in with what seemed like a mild case. We actually thought she'd recover. She was talking, smiling even, telling me about her students. Then suddenly her condition deteriorated. Massive hemorrhaging from the lungs. She was gone in less than an hour. There was a family, the Kowalskis, Polish immigrants. Father, mother, and 3 children all came in on the same day. We put them in beds next to each other. The father died first, then the 2 youngest children. The mother and the oldest daughter survived. I had to watch that woman wake up and realize her husband and babies were gone. Entire families were wiped out. I'm not exaggerating. Entire bloodlines ended. There are census records from 1920 that show houses where every single occupant died in October or November of 1918. And the saddest part? Most of them died without family beside them. We had to keep relatives away to prevent spread. People died alone, terrified, calling for their mothers or their children, with only exhausted, traumatized nurses to hold their hands. I still see their faces. Every single one of them. Nobody talks about what this did to us mentally. The nurses, the doctors, the orderlies. We were all suffering from what we'd now call PTSD, but back then we just called it shell shock, if we called it anything at all. I stopped sleeping properly. When I did sleep, I had nightmares. I'd dream of drowning, of suffocating, of watching people turn blue and being unable to help them. I'd wake up gasping for air, convinced I'd caught it, that this was how it would start for me. Some nurses had complete breakdowns. I watched a colleague just stop in the middle of the ward one day and start screaming. She just screamed and screamed until someone sedated her. She never came back to work. The drinking increased. Lots of nurses started drinking to cope. How else were we supposed to process what we were seeing? We were in our 20s, most of us, watching people our own age die in agony, knowing we could be next. I became numb. That's what happened to me. After a few weeks, I just stopped feeling. I'd watch someone die and feel nothing. No sadness, no horror, just a clinical observation. Another one dead. Next patient. It was the only way to survive mentally. If I'd let myself feel the full weight of every death, I'd have lost my mind. When medicine fails, people get creative. And by creative, I mean desperate. The remedies that people tried would be comical if they weren't so tragic. Onions. People believed if you put onions around your house, they'd absorb the disease. You'd walk down the street and smell onions everywhere. Tobacco. Some doctors recommended smoking to prevent infection. Others said the smoke would kill the virus in your throat. Spoiler alert, it didn't work. Whiskey. Lots and lots of whiskey. To be fair, at least that one probably made people feel better, even if it didn't prevent anything. There were advertisements for patent medicines claiming they could cure the Spanish flu, complete snake oil, but people were so desperate they'd try anything. They'd spend their last dollars on bottles of colored water with fancy names. The really heartbreaking ones were the parents, mothers who'd try anything to save their children. They'd follow whatever advice they heard, sleep with the windows open even in freezing weather, drink hot salt water, wear garlic around their necks. None of it worked. Because we didn't understand viruses yet. We didn't have antibiotics for the secondary bacterial infections. We didn't have antivirals. We didn't have ventilators. We had basically nothing except supportive care and hope. And hope wasn't enough. Here's something that made me angry then and still makes me angry now. The rich fared better. Not because the virus discriminated, it didn't, but because wealth bought you advantages. If you were wealthy, you could hire private nurses to care for you at home. You didn't have to go to overcrowded hospitals where infection rates were astronomical. You could afford better nutrition, which meant a stronger immune system. You could leave the city and go to your country estate. You could access the limited supplies of oxygen and medications. The poor, the immigrants in the tenements, the Black communities that were already facing discrimination, they died at much higher rates. I remember going into some of the poorer neighborhoods. Families of 8 or 10 crammed into 2-room apartments. If one person got sick, everyone got sick. They couldn't afford to miss work, even when they were ill, so they'd keep going until they literally collapsed. And the medical care they received, if they received any at all, was substandard. The good hospitals were overrun. The clinics in poor neighborhoods were staffed by the least experienced doctors and had the worst equipment. This virus exposed every inequality in our society. It didn't create them, they were already there, but it threw them into sharp relief. Remember, all of this was happening while World War I was still going on, and the military? They were hit incredibly hard. The training camps were perfect breeding grounds for the virus. Thousands of young men crammed into barracks, sharing everything. No personal space. The virus ripped through military bases like wildfire. Camp Devens in Massachusetts had over 14,000 cases in just a few weeks. The death rate was so high that they had to bring in Army engineers to build more morgue space. Soldiers were more likely to die from the flu than from German bullets. And here's the insane part. The military kept sending sick soldiers overseas. They knew people were infected, but the war effort came first. So they packed these men onto ships and sent them to France. Those ships became floating coffins. Soldiers would board healthy and die before they reached Europe. They'd throw the bodies overboard and keep going. When they arrived in France, they'd infect the troops already there. American, British, French, German. The virus didn't care what uniform you wore. It killed them all. Some historians believe the Spanish flu actually helped end the war. So many soldiers on all sides were sick or dead that major offensives became impossible. The German Spring Offensive of 1918 failed partly because their troops were decimated by flu. In a horrible, ironic way, the pandemic may have forced peace. Quick sidebar. Why do we call it the Spanish flu when it probably didn't even start in Spain? Because of wartime censorship. The countries fighting in World War I, Britain, France, Germany, the United States, they all censored their newspapers. They didn't want to report on the pandemic because it would hurt morale and potentially give the enemy information about military readiness. Spain was neutral in the war. Their press was free to report on the outbreak. So when people around the world read about the flu, most of the reports were coming from Spain. The Spanish, by the way, called it the French flu, or the Naples soldier. The Germans called it Blitzkatar. Everyone wanted to blame someone else. Current research suggests it likely originated in Kansas at a military base. From there, it spread to Europe with American troops, mutated, and came back even deadlier. But Kansas flu didn't have the same ring to it, I guess. October and November of 1918 were the worst months in American history. Hands down. In Philadelphia, where I was working, we were losing over 700 people a day at the peak. 700 people, every single day, in one city. Nationally, we were losing thousands upon thousands. The exact numbers are hard to pin down because record-keeping collapsed, but the estimates are staggering. Over 195,000 Americans died in October 1918 alone. More Americans died from the flu in 1 year than died in combat during all of World War I, World War II, Korea, and Vietnam combined. Read that again. All those wars combined. And the flu killed more. The infrastructure of society started to break down. Garbage wasn't being collected because the sanitation workers were dead or dying. Phone service was spotty because the operators were sick. Mail delivery was delayed. Some factories had to close because they didn't have enough healthy workers. In some cities, they ran out of coffins. Completely out. People were being buried in mass graves wrapped in sheets or just laid in the ground with nothing at all. There's a photo I saw later. A trench in Philadelphia filled with coffins stacked 3 deep. Just rows and rows of wooden boxes. And here's what kept me going to work every day, even though I was terrified. Somebody had to be there. Somebody had to hold the hands of dying people and tell them they weren't alone. Somebody had to give water to patients and change their sheets and try to make their last hours bearable. If all the nurses walked away, what then? So we stayed. November 11th, 1918. Armistice Day. The war was over. People poured into the streets to celebrate. Thousands of people packed together, hugging, kissing, celebrating. Every public health official begged them not to do it. Begged them. The pandemic was still raging. Gathering in huge crowds would cause another spike. They did it anyway. I was too exhausted to care by that point. I remember hearing the church bells ringing, the whistles blowing, people cheering outside the hospital. And inside, people were still dying. The war ending didn't stop the virus. In fact, the victory celebrations caused another surge in cases. All those people crammed together, sharing their joy and sharing their germs. More people died. The war that was supposed to end all wars was over, but the real killer kept going. Just when we thought the worst was over, The virus came back for a third wave in the winter of 1918 to 1919. It wasn't as deadly as the second wave, but it was still devastating. People who'd avoided it in the fall got sick in the winter. Some people got it twice, though that was rare. By this point, I was barely functioning. I'd lost friends, colleagues, patients I'd cared about. I was running on fumes and the knowledge that if I stopped, if I took even one day off, people would die who might have been saved. The third wave finally started to peter out in the spring of 1919. Not because we'd done anything to stop it, not because we'd developed a cure or a vaccine, but because the virus had simply run out of people to infect. That's how pandemics end sometimes. They burn through the population until enough people are dead or immune that they can't spread anymore. Herd immunity through mass death. What a victory. When it was finally over, we were left to count the bodies and try to make sense of what had happened. Globally, the estimates range from 50 to 100 million dead. In the United States, around 675,000 people died. That's more than combat deaths from every war America has ever fought, combined. Entire communities were devastated. There are towns in Alaska where 90% of the adult population died. Native American communities were hit incredibly hard. Some estimates suggest up to 10% of the entire Native American population died. The economic impact was massive. So many workers dead, productivity collapsed. The war had already strained economies, and the pandemic finished the job. And the psychological impact? We don't even have good data on that. But I can tell you from personal experience, an entire generation was traumatized. Those of us who worked in the hospitals during the pandemic, we were never the same. I struggled with anxiety and depression for years afterward. I'd have panic attacks when I heard people cough. I'd see someone who looked pale or feverish and immediately assume they were dying. I couldn't talk about it for a long time. When I tried to tell people what it had been like, they didn't want to hear it. The war was over. The pandemic was over. People wanted to forget and move on to the roaring 20s. So we stayed silent. An entire generation of healthcare workers, traumatized and silent. Here's what's wild to me. The Spanish flu pandemic killed more people than World War I, but which one do you learn more about in school? The war has monuments, memorial days, countless books and movies. The pandemic? It's barely mentioned. Most people before COVID had never even heard of the Spanish flu, or if they had, they thought it was just a bad flu season. 50 to 100 million people died, and we collectively forgot about it. There are theories about why. Some historians think it's because it happened at the same time as the war, so it got overshadowed. Others think it's because people wanted to forget. It was too painful, too traumatic, too close to home. Unlike war, where death happens over there to soldiers, the pandemic killed people in their homes. Mothers, fathers, children, neighbors. Everyone knew someone who died. Everyone was touched by it. Maybe forgetting was a survival mechanism. Maybe people needed to put it behind them to move forward. But forgetting meant we didn't learn the lessons we should have learned. In the aftermath of the Spanish flu, there were calls for better pandemic preparedness. Plans were drawn up. Recommendations were made. And then, we forgot. We defunded public health departments. We didn't maintain stockpiles of equipment. We didn't invest in pandemic infrastructure. When COVID-19 hit in 2020, we were caught just as unprepared as we were in 1918. We ran out of masks. We ran out of ventilators. We had to build temporary morgues. Healthcare workers were traumatized. History didn't repeat itself. It rhymed. The same debates about masks. The same tension between public health and economic concerns. The same spread through mass gatherings. The same conspiracy theories and snake oil cures. Even the same pattern. A milder first wave, followed by a deadlier second wave, followed by lingering smaller waves. If we'd remembered the Spanish flu, if we'd taken it seriously, maybe we would have been better prepared. Maybe fewer people would have died, but we forgot, and we paid the price for forgetting. So, what did I learn from living through the worst pandemic in human history? I learned that human beings are capable of both incredible selfishness and incredible selflessness. I saw people hoard supplies and price gouge while their neighbors died. I also saw people risk their lives every day to care for strangers. I learned that public health is a collective responsibility. Your choice to go to a mass gathering, to not wear a mask, to not take precautions, that affects everyone around you. Individual liberty is important, but so is community responsibility. I learned that we need to listen to scientists and public health experts, especially when what they're saying is inconvenient or scary. The cities that listened and acted early had lower death rates. The cities that delayed paid in blood. I learned that pandemics expose and exacerbate existing inequalities. The poor, the marginalized, the disadvantaged, they always suffer more. If we want to be prepared for the next pandemic, we need to address those inequalities now. I learned that healthcare workers are heroes who deserve better than we give them. We ask them to risk their lives, to work impossible hours, to make impossible choices, and then we forget about them when the crisis passes. And I learned that memory matters. Forgetting the past doesn't protect us from repeating it. It guarantees we will. Before I wrap this up, I want to take a moment for the forgotten victims, the children who lost parents and grew up orphaned. Estimates suggest over 1 million children in the United States alone lost one or both parents, the parents who lost children and never recovered from that grief. I knew mothers who died a few years later, not from the flu, but from broken hearts. They just gave up. The healthcare workers who died caring for others, nurses and doctors who knew the risks but showed up anyway. They're the real heroes, and most of their names are lost to history. The communities that were destroyed. Small towns that never recovered because too many people died. Native American tribes that lost their elders, their knowledge keepers. Entire generations wiped out. The people who survived but were permanently disabled. The flu left some people with heart damage, lung damage, neurological problems. They lived, but their lives were forever changed. All of them deserve to be remembered. I kept nursing for another 15 years after the pandemic. I worked in hospitals, in public health clinics, in schools. But I was never the same bright-eyed idealist who graduated in 1918. I'd seen too much, known too much, lost too much. I retired in 1933 during the Great Depression, another crisis, but one that seemed manageable compared to what I'd lived through. Economic hardship was terrible, but at least people weren't drowning in their own fluids. I never married, never had children. Not because I didn't want to, but because I couldn't imagine bringing children into a world that could be so cruel. A world where a virus could kill 50 million people, and we'd just forget about it. I spent my retirement doing what I'm doing now, telling people about the Spanish flu, trying to make sure it wasn't forgotten, trying to make sure the lessons weren't lost. Most people didn't want to listen. The pandemic was ancient history to them, barely 20 years in the past but already fading from memory. But I kept talking, because somebody had to remember. Somebody had to bear witness. Here's what I want you to understand. It will happen again. Not might happen. Will happen. Pandemics are not one-time events. They're a natural part of living on a planet with 7 billion people and countless viruses looking for hosts. We've had pandemics before the Spanish flu, and we've had them since. The question isn't if there will be another pandemic. The question is when and how prepared will we be? COVID-19 showed us we're still not prepared enough. We've made progress. We developed vaccines in record time, which is incredible. But we still had the same political fights, the same public health failures, the same conspiracy theories. The next pandemic might be worse than COVID-19. It might be worse than the Spanish flu. Or it might be more manageable if we learn from history. That's why stories like mine matter. Not to scare you, though. If you're not a little scared, you haven't been paying attention. But to prepare you, to remind you that this is real, it's happened before, and it will happen again. So what can you do with this information? First, remember. Remember that the Spanish flu happened. Remember that it killed millions of people. Remember that we were unprepared and that unpreparedness cost lives. Second, support public health infrastructure. I know it's not glamorous. Nobody throws parades for well-funded health departments. But that boring, unglamorous work saves lives during pandemics. Third, listen to experts. When public health officials say to wear masks, wear masks. When they say to avoid gatherings, avoid gatherings. When they say to get vaccinated, get vaccinated. They're not trying to control you. They're trying to keep you alive. Fourth, take care of healthcare workers. They're asked to do impossible things in impossible situations. They deserve our support, our respect, and our resources. And finally, be kind to each other. In a pandemic, we're all in this together whether we like it or not. Your choices affect me, and my choices affect you. Act accordingly. I'm telling you this story from beyond the grave, in a sense. I died in 1957, almost 40 years after the pandemic. But these memories stayed with me every single day of those 40 years. The faces of the people who died, the sound of the death rattles, the smell of the wards, the feeling of helplessness when you know someone is dying and there's nothing you can do, but also the moments of grace. The nurse who worked 20 hours straight and then came back for another shift. The doctor who held a dying patient's hand and prayed with them. The volunteers who brought food to families who'd lost their breadwinners. The Spanish flu showed me the worst of humanity and the best of humanity, often in the same day. If there's one thing I want you to take away from my story, it's this. We're capable of surviving unimaginable horrors, but survival isn't enough. We need to learn, to remember, to prepare. The next pandemic is coming. The only question is whether we'll be ready for it. I hope, God, I hope, that when it comes, you'll remember the lessons of 1918, that you'll remember the 50 million people who died, that you'll remember the nurses who stayed when they could have fled, and that you'll do better than we did. My name was Catherine O'Brien. I was a nurse during the Spanish flu pandemic of 1918. I watched thousands of people die. I held their hands. I gave them water. I closed their eyes when they were gone. And I survived to tell this story so that you would know it was real, it was terrible, and it could happen again. Don't let my patients die in vain. Remember their story. Learn from their deaths. And be ready. Thank you for listening. If this story affected you, I need you to do something for me. Hit that like button. It tells YouTube to share this story with more people. Because this isn't just history. This is a warning, and more people need to hear it. Subscribe to this channel if you want more deep dives into forgotten history. The stories that matter, the ones that changed the world but somehow slipped through the cracks of our collective memory. And here's the big one. Share this video. Send it to your friends, your family, your social media. Not because I want views. I don't even exist anymore, remember? But because these lessons need to spread as quickly as the virus did. Leave a comment telling me what surprised you most about this story. Did you know the Spanish flu killed more people than World War I? Did you know about the mass graves, the overwhelmed hospitals, the bodies stacked in basements? I'll be in the comments reading your thoughts and answering your questions. And if you want to go deeper, I've put links in the description to more resources about the 1918 pandemic. Read them, learn them, remember them. Because the next time a pandemic starts, and there will be a next time, I want you to be the person who says, I know what happened in 1918. I know what we should do. Be that person. The world needs you to be that person. Until next time, remember, history isn't just about the past, it's about preparing for the future. Take care of yourselves, and take care of each other.